So at this time, I'd like to shift gears and introduce our next speaker. Debbie Hersman, President and CEO of the National Safety Council. Prior to joining the National Safety Council, Ms. Hersman served as the chairman of our National Transportation Safety Board. Ms. Hersman was first appointed to this board by President Bush and was reappointed to 2 additional 5-year terms by President Obama in 2009 and 2013. Debbie has also served a number of years on the Hill, both on the Senate Committee on Commerce and Science and Transportation, as well as staff and senior legislative aide positions. Her efforts contributed to the passage of milestone bills such as the Motor Carrier Safety Improvement Act, the Pipeline Safety Improvement Act, the Transportation Equity Act of the 21st century, and the Amtrak Reform and Accountability Act. It is my pleasure to introduce Debbie to the stage.
What, no music for me? Come on. Thank you. It's okay. There we go. Okay. Thank you, Brian. I know Brian's back there behind the curtain doing an awful lot of things. It's so great to be with you all here today in Houston, and I know everyone's saying it's kind of cold here in Houston, but let me tell you, it's a lot colder in Chicago. So it's great to be here. I am so fortunate to be joined by a couple of my colleagues from the National Safety Council, Mr. John Doney and Dr. Wes Scott. John gave a presentation this morning, and Wes is giving one this afternoon, and so thank you all for being here. And how about a round of applause for all of those servers who provided us a great meal today. So I want to say I'm thrilled to be following Reagan because he really teed up the issue of where the oil and gas industry is, particularly on leading when it comes to safety. And I want to talk about some of the areas first where I have actually observed you all lead. You know, one of those areas is one that's really so fundamental to us when it comes to transportation safety, and that's seatbelt use. If I could just get a show of hands, how many of you all have changed your seatbelt use over the course of your lifetime? Yeah, so many people in this room. The people who are not raising your hands, or you must be younger than me, I guess. So, you know, I recall, and it was great hearing the speakers this morning. I recall being a kid, and my father was in the Air Force, and when we would approach the base, and this was when I was probably in middle school, when we would approach the base, they had a 100% seatbelt check sign, and this kind of occurred from the time when I was in elementary school. We didn't have this, but when I got into middle school, we have, because I remember exactly which car we were riding in. And we would approach the gate, and the MP would look in the car, and he'd tell us to buckle our seatbelts. Well, after a few times of getting to the gate and having the MP tell us to buckle our seatbelts and watch us do it, my mom would turn to us while we were waiting in line to get through the gate, and she'd say, "Buckle your seatbelts." And so when we got to the gate, we wouldn't have to be stopped. They'd see us, and they'd push us through. They saw the seatbelts buckled. Well, we got into a habit of buckle your seatbelts, and we all knew we were coming to the gate, so we'd buckle our seatbelts. My mom didn't need to tell us. And then we got to a point where when we got in the car at home, we buckled our seatbelts. We didn't wait until we were approaching the gate. We didn't wait until the MP told us to buckle our seatbelts. But it changed behavior. It changed behavior for not just my dad, who that was his job, but it changed behavior for our family. And that's what I know that you all can do when it comes to protecting your employees and protecting their families. Behavior can change. It can change over time, a short period of time, like I just described, or it can change over a long period of time. The oil and gas industry has been in the forefront when it comes to seatbelt use. You've been in the forefront. Reagan just talked about ExxonMobil's game-changing policy on distraction dating back to 2004, way ahead of where everyone else was. And I'm ashamed to say it, way ahead of some of the safety organizations that were out there. And so this industry has been on the forefront of leading when it comes to taking on new issues, when it comes to taking on tough issues. You lead not just for yourselves, but for your contractors and for everyone who's associated with you and their families. In my previous job, I worked at the National Transportation Safety Board, and we were involved in investigating transportation events, crashes, collisions, explosions. And one area in particular that I had interaction with was the helicopter industry. And so many of you have been probably on a helicopter, transported out to a rig or a platform, or you have employees who are involved in those types of operations. Very risky operations when you look at the aviation environment. Not controlled locations, a lack of weather reporting en route in some instances, variable conditions, moving objects to some extent when you talk about platforms and high seas, evacuating out of the way of a hurricane. There's so many things that potentially could be a challenge. But it was really interesting to me to see when the helicopter industry, particularly serving the North Sea operations, the Gulf operations, the reasons why they made changes when it came to safety was not always because of regulations. Sometimes it was because of economics and contracts and who they wanted to work for. So if it's all about money, there will be a race to the bottom. People will cut costs. They won't invest in night vision goggles, or they won't invest in enhanced ground proximity warning systems, or they won't put 2 pilots in the cockpit instead of 1, or put in potentially autopilot systems. They won't purchase a helicopter with 2 engines for safety redundancy instead of 1. If it's just about money and it's about going to the lowest bidder, you're going to get what you pay for. But what we saw were improvements in helicopter safety operations, particularly in offshore operations, not because of regulators, but because of the oil and gas industry. And when they wrote contracts, they demanded certain things be provided. They demanded that certain safety features be present. They were looking for companies that would provide lift with 2-engine helicopters rather than 1. So you all have a track record of being able to raise the bar on safety, not just for yourself, for others. But I want to take a few minutes today to challenge you to think about another issue, and an issue that may or may not be on your radar screens. It's about talking about prescription painkillers and the overdoses that we're seeing from those, and how impaired employees happen to be on the job, and what you all can do about it as companies. So this is a hidden epidemic, and I'm going to first start by sharing with you some data. So let's talk about what the use has looked like. And so this chart is going to show you over the decades, as far as accidental deaths, the numbers for poisonings: 70, 63, 73, 83, 93. We start to see a spike. We saw the advent of prescription painkillers come onto the scene in the 90s. They've been around for about 2 decades. 2003. And the last year that we have good data, 2010. So let's just talk about the numbers. Follow the numbers. What's happening here? There's something going on. And we can talk about what's going on and what's happened. The prescriptions of painkillers has skyrocketed in the last 2 decades. It's increased by over 600%. What does this mean for us? What does this mean for the people who are taking those prescription drugs? 46 Americans are dying every day from unintended overdoses. These are not suicides, these are overdoses. Why? Why are people taking these painkillers, and what's causing these fatalities? And so I'm going to talk to you a little bit about what the physiological effect of taking some of these painkillers are. Opioid hyperalgesia. Does anybody know what that is? Okay, so very basic understanding of how these painkillers work. And what we're talking about with these painkillers are hydrocodone, OxyContin, things that you all have heard about. They're things that many doctors prescribe. Opioid hyperalgesia is really simple. Your body feels pain. It feels pain as a warning, as an indicator that something's wrong, that you have an injury, that there's something that your body is trying to tell you, respond to this or protect this. What the opioids do is they block that pain, so you don't feel the pain. But when you're taking those pain blockers, it does something to those nerve cells. It's pressing down on those nerve cells so that they don't feel the pain. So those nerve cells start to change because your body's trying to protect you. It does not want you to overdo it. It doesn't want you to continue to fight or work or whatever's going on when you're having that pain. So those nerve cells change and they start to become more sensitive to pain. So they start trying to come through to tell you, we're feeling pain, there's something wrong here. So you start to take more painkillers to dull that response of your body. And so as you escalate the amount of painkillers you're taking, you increase the sensitivity to pain. So what that means is, and this is what we see, is there's an escalation in either the dosage of how much painkiller people are taking over time or the frequency of what they're taking. So when people think about drug overdoses, they think about illegal drugs. They think about cocaine. They think about heroin. But how shocking is this statistic that prescription painkiller overdoses kill more people than overdoses from cocaine and heroin combined? This is the drug overdose problem of our generation. So how many people have issues with prescription painkillers? And I'm not going to ask people to raise your hands because I don't want to make people feel uncomfortable, but they are widely prescribed and they are widely requested by patients. But they are incredibly addictive. This past year, these drugs were moved to Schedule 2 of the drug charts. And basically what that means is they are one of the most addictive drugs that are out there. The only thing that's above them on Schedule 1 are things like heroin and cocaine, things that don't have any medicinal value at all. We're getting to a point when it comes to accidental deaths where we're seeing drug overdoses overtake motor vehicle crashes. That's a good news, bad news story. The good news is we're doing a better job when it comes to motor vehicle crashes. We're driving those down. But the bad news is when you look at that line for the poisonings, and I showed you those charts earlier of what those poisonings are comprised of, and the largest number of deaths from poisonings is the opioid overdoses, the prescription painkiller overdoses. That number is going up unchecked. So, what percentage of employees, people who work with you, who work for you, and our speakers this morning talked about who's on your right and who's on your left. Who are you counting on to make sure they do a safe job all day, every day? So, if I could get a show of hands, what percentage of employees do you think have used prescription drugs to get high or to self-treat? Who thinks it's 10% of the workforce? Okay, higher, higher. Okay, you guys want me to go higher? 15%. Higher. 20%. Okay, all right, I'm not going to keep playing this game with you guys because nobody's raising their hands, but it's 23%. And this is self-reported. 23% of employees say they have misused prescription painkillers. Employees who use prescription painkillers, misuse prescription painkillers, are 3 times more likely to be involved in a workplace incident and 5 times more likely to file a workers' comp claim. So we've got some surveys that we've taken a look at different organizations. Accident Fund Holdings examined its claims and found that the cost of a typical workplace injury, the sum of an employee's medical expenses and their lost wage payments, was about $13,000. But when a worker was prescribed a short-acting painkiller like Percocet, the cost tripled to $39,000, and when they went to a stronger, longer-acting opioid like OxyContin, it tripled again to $117,000. Workers who received high doses of opioid painkillers to treat injuries like back strains stayed out of work 3 times longer than those who had a similar injury but were treated with lower doses. So it's really important what people are getting and how much of it they get. We know employees who are treated with prescription painkillers for an on-the-job injury. If they take a prescription painkiller at a high dose, if they return to work 3 months later, they are probably going to still be on that prescription painkiller. So why is this a concern, and why is this a concern to your industry? You all are in a safety-sensitive environment. When Dr. Michaels and Dr. Howard and John Howard talked this morning, they talked about some of those charts, and you compare the injuries in this industry and the oil patch industries to others. You guys are in a risky industry. Talked to somebody who's in the oil and gas industry, and they talked about an experience that they had with an incident. There was a crane operator out on a platform, and they were unloading supplies and equipment that had come in to the platform, lifting it off, putting it up on the platform. This is an inherently risky operation. There's a lot going on. It's very dynamic. They had a big container that they were lifting off, and they were putting it into a small space, a confined space. There are, of course, all sorts of checklists, requirements, procedures, things like that that people are supposed to follow, these standard operating procedures. This crane operator almost crushed one of his fellow employees who was in the space where he was about to put that container. Had it not been for a few other employees who were involved in the operation, spotting, telling him stop, stop, stop before he had put it in, there would have been certainly serious injuries, if not a fatality, involved in that situation. When the organization went back, they tried to unwind it, try to understand what happened. They looked at risk factors. They looked at the length of schedule. Was he fatigued? They looked at whether or not he was trained, familiar with the equipment. They really unraveled everything. They came to a question of why this well-trained, rested employee would have made a mistake like that, and they found that he was actually taking quite a few medications, including prescription painkillers. And the other piece of it that was disturbing was that all of his co-workers, all the people who worked with him, all knew he was taking a lot of medications. But here's the catch. Just because something has been prescribed by a doctor or a physician doesn't mean it's safe. And it certainly doesn't mean it's safe to be taking that medication or that medication in combination with others in a safety-sensitive work environment like that. So what can you all do, and what are some of the issues that need to be paid attention to here? 70% of addictions start with a valid prescription. And so a lot of people who are having addiction issues with the prescription painkillers have a very legitimate reason for getting them in the first place. So the people who are most at risk are people who have already either a family history or a personal history with addiction. And addiction could mean anything from drugs and alcohol, even to smoking. And so just the studies have shown that there's a predisposition for people who have that history. If anyone suffers from depression or anxiety, this is another area that could be a hallmark, because the drugs that are used, these prescription painkillers, also function as antidepressants, and they actually, it's kind of what is happening in people's brains as they're using these. And then long-term use of prescription opioids, as we talked about, escalates that process and that addiction. So what can you do? There are 3 things that I'd like for you all to take away from this. One of them is to make sure that you have a drug-free workplace policy and testing. What does that mean? That means you have to have, for sure, a policy about what it means, which drugs are included, and you need to couple that with a drug testing program. At the National Safety Council, I joined in May. In this summer, June and July, we issued an employer toolkit for drugs, a prescription drug employer toolkit. One of the things in there is drug testing. And so I asked our team, do we do this? Do we do drug testing? No, we test for the illegals because that's kind of pretty common. And I said, well, if we're putting this out for other people, we should do it ourselves too, and we need to add these prescription painkillers to our drug panel. We don't have safety-sensitive employees to the extent that you all do, but it's a good idea. Well, you know what? When our HR folks went back and they checked with our drug company that does our pre-employment drug screens, they found that we were already testing for 6 drugs. It was going to be the same cost if we had a 12-drug panel as it would for the 6-drug panel. So making sure you have a good drug testing policy and that you add these drugs to your drug testing screen. Second, educating your employees on prescription drug use. There is a lot of misinformation. The drug companies have done a great job marketing these drugs by brand name. You can see their prescriptions have shot up, but we've also released information and studies that a combination of other drugs, non-addicting drugs, Tylenol and ibuprofen, actually do a better job at controlling pain than some of these prescription painkillers. That's also available on our website if you want to take a look at it. How many of you all have been to the doctor for an ailment and been prescribed some of these drugs? How many of you all took a few? Maybe it helped, maybe it didn't, but then these drugs sat in your medicine chest or medicine cabinet for a long time. How many of your doctors may have given you 50 or 100 pills when really you only needed 5 or 10? And what do you do with those drugs afterwards? So it's about educating people to make sure that they know when they go to the doctor what they ought to be talking about and what they ought to be asking for. I had 2 C-sections. I got Percocet, I got prescribed medication. It sat in my medicine cabinet for years, unused. And until I came to this job and understood about these drugs, I didn't understand how dangerous it was. Family, friends, your kids, people are taking these drugs out of people's medicine cabinets. 75% of the people who have addictions are getting drugs from family or friends. We wouldn't leave heroin out on the counter. Why would you not want to lock up these drugs? So if you're taking these drugs, make sure you protect them. And if you don't need to take these drugs, there are drug programs, take pill, take back programs that you can take advantage of. And the last thing that I would say is, in addition to the policy and the testing, in addition to the education, make sure you work with your healthcare providers, with your EAP providers, with others. This is an addiction. If you have employees who have this, and by the way, 2,500 people here, 1% of the population has an addiction issue with prescription painkillers, so probably 25 people here in this room are dealing with something like this right now. Many of you probably have family members who are dealing with something difficult like this. People can get help. you can refer them. You can use your EAP program or your healthcare providers to assist you with this. I know we're getting tight on time, but I just wanted to show you a quick example when it comes to claims and costs. Texas here, the Department of Insurance, the Workers' Comp Division, actually created a program where you had to have pre-authorization for 150 different drugs. Of those 150, 25 of them were opioids, cannabinoids, muscle relaxants. And what this meant is you had to get pre-authorization before getting prescribed these drugs from either the insurer or, if you're a self-employed or a self-insured company, from the employer. The amazing thing about this was when they put this pre-authorization in place, from 1 year to the next, it reduced the prescribing among newer claims by 74%, and it reduced the costs spent on these drugs from $4.4 million in 2010 to $800,000 in 2011. That is a huge issue when it comes to abuse and curtailing the abuse. The National Safety Council is doing a lot, working on legislation to eliminate the pill mills, making sure that there isn't the ability to do doctor shopping, so that there are programs that are checking between pharmacies to make sure people aren't getting multiple prescriptions. But you can do so much as an employer. This is a huge issue out there. It's affecting your employees. It's affecting their quality of life. We know that when employees are involved in employer intervention programs, it's much more successful than when they're referred by family or friends. We also know that this is truly a leadership issue. The Black Hawk Down team talked about this morning. They talked about the people who are on the right and on the left, but the people who are in front of you and the people who are behind you. And so, as leaders, particularly for those of you who are safety leaders, this is an opportunity for you to take a leadership role within your organization and address this issue. We have a prescription drug toolkit. It's free. It's available on our website. I did bring a few copies of it here with me, so John and Wes are over there. We've got copies for you. But this morning when the team talked about from the lowest cat on the team to the highest general officer, if you're not pulling your load, you're letting people down. And if you know that there's something out there that's killing people, that has a safety impact, and you can do something about it and you don't, you're not pulling your load. And so when we talk about leadership, sometimes it's about doing things that are hard. Sometimes it's about doing things that are unpopular. Reagan talked about the cell phone policies. But at the end of the day, whether it's getting compliance on buckling a seatbelt, getting people to put their devices, electronic devices away, or if it's helping people to make sure that they don't have an addiction to a prescription painkiller, a good leader will take people where they want to go, but a great leader takes people where they need to go. So I thank all of you for everything that you do. I thank you for being here and being a part of this conference. And I thank you for being great leaders. Thank you for having me.